just for your information, and that you're aware that this presentation, you're most welcome to share it once we are able to release it to everybody. There will be a few short breaks that will happen throughout the webinar, which Johnny and Aaron will be able to facilitate that piece. We hope to conclude the session by noon today, so everybody gets to lunch on time. Please note that following the webinar, there will be a brief e-survey. So please make sure that you take the time to complete it, because it will help us improve future training sessions as well. In the evaluation, you'll also have an opportunity to forward questions as well. And so please keep an eye open for it. The e-survey should be coming to you within about a 24-hour period after the event. And no, it won't be Saturday, probably on Monday. So just so you're aware. And finally, the presentation information that's going to be presented, we will make it available to you as well. Once it's made available to us, we will be posting it for your future reference. Now, the need for the sector to carefully examine mental health and safety in the workplace has never been more important than it is at this moment. And the intent of the webinar is not only to provide key information and resources, but to listen to you for guidance and support on how we can work together collectively. That being said, I'm delighted to introduce our presenters for this morning's webinar, Johnny Morris and Aaron Secker from the Canadian Mental Health Association BC Division. Johnny is the Chief Executive Officer for the Canadian Mental Health Association. He has extensive background working in public service at the Ministry of Mental Health and Addictions in a senior capacity on policy and legislation. Johnny has a long-standing research and practical history in suicide prevention as a counselor, and also has also held several teaching appointments at the University of Victoria and Douglas College. I'm also pleased to introduce Aaron Secker, Associate Director at the Kwantlen Canadian Mental Health Association office, who has many years of experience as an educator. She effectively collaborates with workplaces by fostering psychologically safe and healthy environments for their staff and clients. She holds a master's in education and is a certified professional human resources certification as well. That being said, please welcome Johnny and Aaron, and really excited about this session, and I'm sure that you will be as well. So thank you.
Thanks so much, Sarat. It's a real pleasure to be here today. Before we kick things off officially, I'm just noticing in the chat here, some folks may be having audio difficulties and some may be new to WebEx. So just to make sure you're all feeling comfy in this space, you should be hearing and seeing us as presenters on your main screen here. If you're seeing me move my lips and you're not hearing me, folks are hearing, so it might be a question of just activating your speakers or just making sure your audio connection's connected to your computer. Hopefully you're seeing everything okay on the screen. And there is a kind of a Q&A box, as Sat mentioned, on the right, and a chat function. We do have Matthew Merrifield here, who is behind the scenes. And so if you do encounter any difficulties, do raise your hand. Okay, let's launch this rocket ship this morning, and let's hope all goes well with the technology. Here we go. Aaron, you can be my litmus test here. Is that showing up okay on your end, Aaron?
It is. We are seeing the whole window, though.
Okay, that's okay. That's okay. Sometimes when I press the go to presentation mode, my computer explodes. So we will, so it's looking okay. Okay. Great. So we are so thrilled to be here. We know these are extraordinary times and we're joining you virtually. So we can't pick up the energy that we would be feeling in a room, but both Aaron and I are super excited to be here. We've got other members from the BC Division team, Ashley Rinus and Pamela Findling joining behind the scenes. Aaron works with CMHA Kelowna, and we've got colleagues from far and wide, including a colleague you'll meet in a second from the Ministry of Mental Health and Addiction. So we're thrilled to be here. Today is a 3-hour session really focused on building psychologically safe and healthy workplaces. And we're so excited to be here as part of the inaugural webinar for the newly minted Health and Safety Council that SAT's leading there with many, many other folks. So brilliant to be here. Before we move along, I do want to follow up on SAT's acknowledgement, and I'm sure Erin will do the same when she speaks a little later in the presentation. I'm joining you this morning from unceded, ancestral, and traditional Coast Salish territories, particularly the Lekwungen-speaking territories, the Wasanic nations, and also the chartered community of the Métis Nation of Greater Victoria today. And I'm very humbled and very privileged to be joining you from these unceded lands as an uninvited settler. So very honored to be here today. The other thing that is critically important for us to both acknowledge, mention, and ensure underpins the work we're going to do today around workplace mental health in the community social services sectors is an acknowledgement of the confirmation, the recovery, the unsurprising and devastating findings this past number of weeks at Kamloops, the former Kamloops Indian Residential School at the Kamloops Shishwetmak, and also other sites, including Kawas, that was disclosed yesterday. We here all want to extend love, support, care, strength to all of the families, communities, and elders who are experiencing hurt, trauma, and compounding trauma as a result of these confirmations. And we're standing by alongside in imperfect solidarity with Indigenous communities across this country as the coming days unfold, and recognizing so many of you sit alongside and work within and serve Indigenous communities, and wanting to recognize Indigenous partners, colleagues on the call as well this morning. So wanting to underscore that acknowledgement. So the other couple of pieces that I wanted to add in before we move into the work of this morning is there are many folks who are coming together around this endeavor. And as Sat said, workplace mental health has taken on an imperative and an importance that we haven't seen before. Given all of the things that we are collectively responding to right now. And so I just want to name here, many of the folks who've helped shape our work so far, including the Health and Safety Council. You're going to see some neat folks this morning in some videos from the BC Federation of Community Social Services. And of course, all of you, whether you're working in frontline service capacities, other roles within the community services sector, you have been for a long time carrying a significant load, expending significant energy, because we're part of the same sector as you. We care deeply about making change in the world alongside each other and the people we serve. So just really want to acknowledge that and respect all that you have been leading for some time across dueling public health emergencies here in BC and beyond. And also very important to note that this work is being supported by the province of BC, particularly the Ministry of Mental Health and Addictions, and also the Ministry of Social Development and Poverty Reduction. So just wanted to say thanks for the strategic direction that's being provided by the province in this work as well. So what's in store this morning? So just to give you a sense of the horizon ahead of us, we're going to do a little bit of context setting for a few minutes. I spent some time with Sherry Sinclair at the BC Federation of Community Social Services and a number of other folks recently, and we really wanted to start with a bit of a conversation, and we're going to make this as interactive as we can using some technology about the values that drive our work in the community social services sector, and I think that's such an important departure point for this kind of conversation. Rather than starting with deficit and challenge and problem, let's start with why we show up to work every day. We're going to take a short break, as many of us have been deluged with screens for a long time, and we'll give you a bit of a screen break in and around 10. The timing might be slightly off, but we'll make sure we take a 10-minute break. And then we have a training segment with Erin here. So Erin's going to walk us through a training segment as part of the session today, really focused on the micro skills related to checking in and offering support to a staff person that you might be concerned about and worried about. So she's got some teaching principles, and you're going to see a role play. This is the first time Erin and I have ever done a role play in front of 500 people in WebEx ever. So we might break the internet this morning, but we're going to try a role play just to bring some life. If we were in a room, we'd break you all up into little pods and do all sorts of fun things there. But this is what we're going to do in our virtual space. We'll take another little break there. And then, as per the abstract you saw, we really want to equip you with two things. We really want to remind you, reorient you, let you know about available mental health services and supports, some of which could be helpful to you in your work, in your practice as a community social services professional. And we also want to introduce you to the Workplace Mental Health Hub and some pieces that are coming together in partnership with the Health and Safety Council and the BC Fed and Labour through the summer and into the fall. And some of this very much informed by the feedback many of you gave when I met you a number of months ago at the resiliency session that was hosted by Cecilia. And then we've got some takeaways at the end, and we'll bid you adieu at around noon so you can go for your lunches. So today is a learning session. It's a learning opportunity, and we really want to frame up some of the things that we hope you'll be able to take away at the end of the day. The first, we really hope by the end of today's session that you're going to be better able to understand, develop a basic understanding of the responsibilities in the workplace if you're concerned about another employee, and have some additional confidence about how you might take on that conversation. So that's one of the first learning objectives that we framed up for you today. Number two, we really want to support you to be able to identify at least 3 mental health services and supports that are available right now, many of them virtual, that you can have in your back pocket, either to connect someone to or to consider exploring yourself. And then third, we really hope that you'll be able to describe in a little bit of detail the role of BC's new Workplace Mental Health Hub that we are designing with some specificity around the community social services sector. So that's what's ahead of us this morning with the learning we have underway. We really want you to take good care of yourselves this morning. Many of us are fatigued, many of us are tired, many of us are still juggling the realities of our day-to-day work life and the realities of home lives too, even as the kind of the clear and present danger of the coronavirus starts to recede here in the province with really strong vaccination rates and some relaxation of public health measures. It's been a marathon, and there's some road still to go in this marathon. And so just really wanting to acknowledge that collectively for you as an amazing group of community social service professionals. If you need to take a screen break or if you need to take a few moments, of course, please do during this session. We do have a few hours with you this morning. Extra support is available if any of you need to. Many of you likely know this resource, 310-6789. That's the province's mental health support line. So there is support available if anything comes up. We're really staying at quite a high level during this webinar because it's virtual and because we can't see you and interact with you. We won't be going into in-depth pieces per se. We will be creating as safer place as possible to do this work. You're welcome to share comments in the chat. Erin, when I'm speaking, we'll be keeping a close eye there. And when she's speaking, I'll keep a close eye too. And we'll be using a piece of technology called Mentimeter today. It's going to be a bit of an experiment. But whenever you comment in Mentimeter, your comments are anonymous. So you should know that. If you use any of the chat functions, if you comment privately to Erin and I, we won't share your name with the broader group. But if you comment publicly in the chat, your comments might be visible to others. So just so you're fully aware of that too. And we want to infuse some fun. So this was inspired by a conversation earlier this week with Michelle and Camila and Shai Rose and Sherry. We talked about how we can infuse some energy into this space. And so there are 2 prizes available today. Prize alert number 1 is spot the difference. So the challenge you have, and we'll see who's right at the end, is to notice what difference you might notice about me between this moment and at the end of the webinar. So you have a spot the difference challenge, and there'll be a race to the finish there, and we will see who gets to the post first, and you'll win a gift card. Very exciting. And prize alert number 2 is if you register for our Community Social Services Early Adopter List for the free CARE training program, the CARE certification, which you'll learn about toward the end of this presentation, you'll also be entered into a fantastic draw of a gift card. So 2 prize alerts today, really exciting. And also for being here today, we hope to work with the Health and Safety Council to issue you with a certificate of attendance, because you're investing a significant chunk of time hanging out with us to talk about workplace mental health. We want to be able to acknowledge your presence and your investment of energy this morning. So on that note, I'm just going to do a little transition here to a dear colleague of ours at the Ministry of Mental Health and Addictions, Heather Brettschneider. I'm going to stop sharing my screen in a moment, and Heather's going to be able to unmute herself and share some comments. Heather is a fantastic partner. She holds the role of the Director of Workplace Mental Health and has been partnering with us as our sponsor and our funder alongside Ali Butler and many other colleagues at the Ministry of Mental Health and Addictions. Heather holds such a unique role in this province, being the Director of Workplace Mental Health at the ministry. It's a vast, complex, and ever-growing portfolio, and we're deeply, deeply appreciative of the investment in this work and the expertise and time that Heather shares with us. So, for a quick word from our sponsor, I'm going to hand things over to Heather to say hello.
Hi, Johnny. Thanks so much. And thanks to everybody for carving out the time. What an impressive group of folks. Like, I consistently hear what a priority it is, psychological health and safety. And it's one thing to say it, and it's another thing for folks to show up and commit the time to doing it. So thank you, everybody, for coming today and carving out some time. And I just wanted to first acknowledge I'm calling in from the traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations here in North Vancouver. And yeah, I just wanted to just emphasize the priority and the opportunity that the Ministry of Mental Health and Addiction sees workplaces playing. And even before COVID-19, the ministry really recognized that workplaces play such a critical role, and we have such an opportunity to really position them as a key player to improve access and improve the quality of care for folks. So a few years ago, the ministry launched its 10-year strategic vision for making positive and lasting change for the province with its Pathway to Hope document. And in Pathways, workplaces were identified as a priority action underneath the pillar around improving access and improving quality of care. And I think it's a real reflection of the opportunity that workplaces have to promote mental health and well-being, to protect the health and well-being of workers, and to really be an active participant in shaping how individuals and by extensions families and community and the economy all can thrive. COVID-19 has certainly presented us with a lot of challenges, but within that there's a huge opportunity for workplaces, I think, to shine and really be the stars in how they show up for their workforce in workplace mental health. And like Johnny said, this is no longer a sort of nice to have. This is sort of our imperative as leaders. And I know you're sort of wearing 2 hats today, keeping in mind how you can always support the folks around you, your colleagues, whether you supervise them, but also not forgetting about yourself. You know, we consistently hear that workers, especially leaders who are reporting to executive and supporting staff, are really feeling that pressure. So think of these resources as tools, not just for the folks that you care about, both on the front lines and your staff, but also for yourself. So I'm really excited to be here. I'm going to hang out in the background all day and listen, but we're so excited to embark on this next piece of work with CMHA and CCIA, and just look forward to what comes. And yeah, have a great session. And thanks for giving me a bit of time today, Johnny. All the best.
Thanks so much. Thanks so much, Heather. Great to have you with us, and thanks for all of your support. Mr. Merrifield, the host, I might just need you to reactivate my sharing privileges once more, just so I can pull up the slide deck again. I don't know if losing sharing privileges is a reflection of how compelling I was in the first few minutes of the presentation. Thank you. I'm clear. I've been reinstated. That's great. Okay. Erin, can you be my litmus test again and just confirm that this is showing up okay on everyone's screen?
It is, you're good.
Thanks so much, Erin. So we're going to move into the first chapter of our session today. And Heather, I so appreciate you sharing that context. And I think for folks here, you know, you're getting a real sense of the importance that workplace mental health has and how it is featuring in the strategic direction of the province. And for us here at CMHA and for our key partners at the Health and Safety Council and the BC Federation for Community Social Services. So on your screen here, you see a cloudy road, and some of you will have heard me share this story before, so it will be a bit of a repeat for a few moments, but for a number of you, you might not have heard this piece. And what I've been doing quite a bit recently is trying to match the messaging I share as a spokesperson for CMHA about trying to reduce stigma and to take things into the light and push back on the silence that we experience around mental health, whether it be in our workplaces, our homes, our schools, or our communities. And I've really tried to foreground all of this work that we're doing in partnership with others with just a little bit of my own experience. And the reason I do this is because at CMHA, we hold space for so many people to share their experiences. And some of you might remember me saying that I was at our Bottom Line conference, our signature workplace mental health conference that will be making an appearance again next March. And I was listening to three people last October, each sharing the challenges that their experiences of distress and mental health problems had caused in their ability to work, their ability to hold on to work, their ability to feel that they could work with dignity. And my story is different to that, but there's a link there about how not knowing where to turn and not knowing where to go can be so impactful. So, you know, if we rewind 20 years ago, I started as a student in child and youth work. So I'm a child and youth care by training at the University of Victoria. And I remember being an international student, the first couple of years, 3 years probably, being a blur. One of my friends says, "We lost you for a year, Johnny." And the reason they lost me for that year was because I experienced a really profound depression. I was super depressed for that period of time. And people started to notice changes in me. And you'll see this in Erin's work later on. People started to notice me not going to class, not handing work in, withdrawing socially. And I didn't know what was happening and didn't know where to go for help. And things were pretty dire at a number of points, including a question as to whether I'd actually get through school. It was a game-changing conversation that I had with a professor that really created the few degree shift that I needed to reach out for help. And this professor, who I still know to this very day, opened up a conversation, listened to understand, didn't judge me, knew his role, knew my role, and helped create the conditions that I needed to feel okay speaking with him and then going to talk with a counselor and to get some help. And I recognize I definitely had privilege and the ability to access services, and we have huge challenges in our system right now around not being able to access care equitably, though change is afoot, I know. But it was that conversation with him, listening to understand, that really helped move things a few degrees for me to finish my undergrad, finish my master's, and then work for 25 years or so in 20 years or so in community mental health care. So I share that story because I was at a point of moving through a series of stages, early signs, you know, pretty acute signs, to the point where I might have not been able to finish school and carry on. And the power of a conversation, the power of listening, the power of a gentle inquiry, the power of not shaming, blaming, judging, stigmatizing someone for having an experience of distress. And so I share that story just as a starting point for today, and as an invitation for all of you who are trained, caring, skilled, compassionate people. You have to be those things, I think, to be effective in the community social services sector, as an opportunity for you to think what kinds of conversations you might have in your workplaces as we all try to step toward building workplace mental health across our workplaces. So just a little bit of background, CMHA, we're one of the most established national charities in Canada, and here in BC, we have a number of branches. Erin works at one of those branches, CMHA Kelowna, and we respond to about 100 communities across the province. And we are so thrilled to partner in this work because we fundamentally believe mental health starts where you live, where you learn, where you work, and where you play. And we can respond to individuals, and we do a lot of that work with partners ourselves. But we also believe that it's so important to change the cultures in our workplaces or communities or schools. We also know that we need to tackle big things like housing security, food security, feeling safe and free from discrimination and violence and trauma. All of those things add up to either a recipe for flourishing and good mental health when they're addressed, or they can really impact our mental health and get in the way of everyone's right to good mental health. So that's why we do this work. We're very much about trying to shift and change the systems and the places in which we live and play. And we do that through mental health promotion. We do that through policy research and advocacy. We do it through direct and indirect services, some of which you'll hear about later on in the presentation and the training, and supporting our branch network across the province. So we are really trying at this point in time to reach as many British Columbians through their lifespan around workplace mental health. Trying to uplift the voices of BC's nonprofit organizations, like many of you work for, in addressing both the challenges that you see in the clients that you're working with, and also the challenges faced by this sector. And this is why the creation of the Health and Safety Council is so important. It's so important that that voice is taking hold and shape in the province. And we're also trying, as you can see on the right here, to really advance our human right to our best possible mental health, that we have a human right to mental health, and really trying to build systems in partnership with others, including the province, to ensure those drivers of mental health that I mentioned previously. And so Heather started to think about this, and I'm not going to linger here very long, and we're going to turn to an activity in a second about the values that bring you to this sector. So I encourage you to start thinking quietly, privately on your own about why you show up in this sector, why you come to this sector. We've got a couple of blocks here on the screen, and I think just some of it I think is really important to recognize. Almost half of Canadians have experienced a worsening in their mental health since the start of this pandemic. We've seen 40% of Canadians report that, and 60% of Canadians who are living with a mental health or a substance use problem say the same. So people living with a mental health problem, people living with a disability, people who are racialized, so Black, Indigenous, people of color, 18 to 24-year-olds, and women have actually been some of the hardest hit groups of Canadians, people with regard to their mental health since the pandemic started 18 months ago or thereabouts. The pandemic's also disproportionately impacted people who already experience other forms of marginalization. And we know that you see this every day in your workplaces across the breadth and diversity of the community social services sector. And so I've talked with a number of nonprofit leaders recently, and many are saying that the reservoir feels as if we need to start filling it up. There's a sense of depletion, and I think across sectors, people are feeling that. And so this is an opportunity not just to say, well, be more resilient and, pull up your bootstraps. We're not saying that at all, but how do we work collectively to address both individual mental health and the collective social conditions, structural conditions in which our sector finds itself operating? And that's why the BC Fed is so key, given the very skilled advocacy and amplification of sector perspectives that it does every day. And we're proud to be an associate member of that federation. Workplace mental health, the most cited reason for leaving a job is increased stress or strain at work. And that's what we've seen in the research. And in the WorkSafe data, I think many of you are aware, claims are steadily increasing at the WorkSafe level, and also in the area of short-term disability or short-term sick leave, and also long-term disability and long-term sick leave. We've seen for a long time big drivers in those factors, including in my own organization and our own sector, over time. 30% of workers would say that they are concerned about the mental health of a colleague. And that's why Erin's work later today is going to be so important in framing up what you can do if you are concerned, what the steps that you can take to bring yourself alongside someone that you are worried about, and make sure that you're not forcing people to tell you things that they don't want to tell you, but showing up, much like my professor did a number of years ago, to listen, to understand, and to help people get connected to the right care and resources. Balancing the mental health needs of employees and also your operational challenges are challenging. We've been doing a whole load of work in the continuing care sector with the Safe Care BC Health and Safety Association. And those operational pieces in the health sector, I'm sure you can all imagine, is incredibly challenging with recruitment, retention, and the profound impacts of this pandemic upon health worker mental health. So that's something we hope to support you with some of the work that we're launching today and into the fall. And we're also noticing high anxiety. Charities, many of you are nonprofits, many of you are charities and rely upon government money, donations, the generosity of your volunteers. And so as a sector, I think that's important to recognize too, some of the precarity in our sector. So what are we up to? We are, today is the culmination of a number of months of work, working in close concert with SAT at the Health and Safety Council. And you'll hear from 3 speakers this morning who are, I think, articulating the excitement of this being the time. The time is now to really, truly grapple with workplace mental health in the community social services sector. So we're working with labor, we're working with WorkSafe, we're working with health and safety associations and industry and the ministry, all trying to grapple with building capacity in our sector as we move through this next stage of the pandemic's recovery, so that mental health can be absolutely prioritized in our sector. And we at the Canadian Mental Health Association are grappling with the same challenges across our federation and in my office. And so we're right there with you in trying to figure this out and work this through using the latest evidence, the latest thinking, and the latest teaching and education. So what we're going to do now is you're going to hear from someone in a second, and we're going to kind of do some interaction here together. I'm going to stop speaking, and whilst this interaction will be silent, you won't be able to hear each other. Visibly, you're going to be able to see and experience some of the energy in this virtual room. This virtual room contains, I think, almost 500 souls across the province and beyond, all who've come here today because you're either curious or you care about or you want to learn more about workplace mental health. And in so many ways, and you can see this on your screen, passion led us here. For so many of us, and I remember getting into mental health as a crisis line volunteer when I was 16 back in the UK. A passion for wanting to make change is a driver for so many of us in the community social services sector. Passion isn't enough, of course, to tackle the challenges of workplace mental health, but it is a mainstay. It is an anchor. It's a touchstone for so many of us in doing this work on a day-to-day basis. And I see that across my team in so many ways at the Canadian Mental Health Association. And I know it's so evident in your organizations too. So hopefully this will work technologically in a second. And before I pull it up, I invite you to think about the values you hold in the work. But you're going to hear for a few moments from Sherry Sinclair. Sherry is the Director of Programs and Services with the Federation of Community Social Services of BC. And Sherry graciously pre-recorded a short video that I'm going to play for you now, which really speaks to both the values and the imperative of this work. And I think it's an important perspective. So whilst I pull this up, just take a moment to think about the values that you bring to your work and how those values are important when it comes to thinking about workplace mental health. Erin, can you be my litmus test again? Are you seeing Sherry on the screen?
I am, yes.
Great, okay. And maybe Erin, let me know if you can hear Sherry in a moment.
Hi there, my name is Sherry Sinclair and I'm with the Federation of Community Social Services of BC. I am here on the unceded traditional territory of the Musqueam, Squamish, and Tsleil-Waututh peoples. I'm here in southern also called Vancouver. I am the Director of Programs and Services here. I am so happy, the Federation is so happy to be working on this project together, the community social services and workplace mental health. And isn't it time? Isn't it time for the hard work, the heart work, the connection work to be supported and to be held up, to be connected, to be finding a way, forging a path for community social services in the way that will serve everyone in our sector. Thinking of best hopes, what would we want? What would be the thing that would speak to us the most? And that would be helping us to express the value, why we come to work. So that can be held, that can be supported, and that can be communicated. Just thank you so much for coming to this session today. And we're really looking forward to working together and finding the path that fits for community social services to support mental health in the workplace, us in our individual organizations as we meet together in larger groups. So we can do that pretty soon. Just really excited about that. So thank you again, and very, very excited to have the partnership here with Johnny Morris and the team at Canadian Mental Health Association here in BC. So stay tuned. We are going to do all we can to stay in communication with you and keep you absolutely in the know of what's going on here as we go forward with this. Thank you. Have a great day.
So you got to hear a bit of a sense there from Sherry, and thank you so much for sharing your perspectives with us from such an important partner. In so many ways, what Sherry was saying there I think re-emphasizes the opportunity for us to connect with those values that underpin our work, and link those values to this concept, this idea of how we gradually improve workplace mental health. And it's not going to happen with the occasional training session. It's really going to take training, connection, and learning, and you're gonna see a little bit of that today. So what I'm going to do now is pull up a Mentimeter slide here, and Mentimeter. So if you've got your web browser open, and maybe Erin, I'll just get you to do a confirmation again.
Yep, looks good.
Thanks so much for doing that. If you have a web browser open, for those of you who are listening in on this session, this is your opportunity to share your response to this question. So you would go to www.menti.com. You'll see that at the top of your screen there, www.menti.com, and it will prompt you for a code, 24217596. And you can use a browser on your computer or on your phone. Thank you, Erin. And so I would love for you to go to this Menti website, and the code should show up. There it is. And simply type in your response to this question. And the question is, why do you work in the community social services sector? Why do you work in the community social services sector? So here, well, thank you so much for kicking us off here. You can see the comments, and so this will start to scroll up on the screen in a second here. To help and connect others. We see passion come up a few times here. To help others live the life of their choice. It feeds my soul. What a powerful comment there. To feel like I'm making a difference. So I'm just going to slowly scroll up here, and we'll make this available to our friends at the Health and Safety Council as a artifact from today. But you can see so many of you are filling out this commentary. And thanks, Erin, for making the chat available too for folks who can't use Menti. So I'm just going to let you soak this in for a moment. 500 plus voices here of value-laden reasons for why you work in the sector. Many of you talking about how much you care about the communities in which you live. One of you saying that you want to give back to a community that supported you. We'll just give this a couple more minutes and let you soak up these values. Gives you a reason to keep going. One of you likes to shake things up. Great. We'll just give it another 30 seconds here. Thank you so much for doing that. So you can see here on the screen, and I'll just scroll back up here. Just such a good example of situating the value of this work. And I know Sherry's listening in this morning, and would welcome you in the chat, Sherry, to add your own thinking around the importance of value. This very much was influenced by you in our planning conversations. And so you can see here, so many of us bring a transparency and a deep value to the work of being in community social services. And you can see how these values can help us stay, can help us maintain our connection to this work. And also, there's an inherent vulnerability to these pieces as well, because we're showing up with empathy, we're showing up with care, we're showing up because we have hope and we want to make a difference. And I think it's really important to recognize that it's pretty tricky to realize those things, particularly when we have lots of structural challenges and profound things, including the challenges we're seeing this very day affecting our work in the community social services sector. So these values, I think, are so key for us to hold on to and think through in the context of workplace mental health. I'm just going to pull up a second Mentimeter now, and we'll see how you respond to this question here. So you're in the same Menti space, and I'll pull up the screen share again, and I'll explain why I've asked you this question. So hopefully you're seeing a new Mentimeter. So before you shared some of the values that you'd brought into the work, hang on a second, I've got the wrong one here. Hang on a sec. Actually, we'll stay with this one. Hopefully you can see this one on your screens too, and it's another opportunity for you to weigh in for a moment here. So you have an opportunity to describe the community social services sector in 3 words. So you can just type words. We'll let you do that for a number of minutes here. So you can see at the center of the screen, the bigger the word, the more it's being typed by you in your offices or your homes or wherever you're dialing in from. And you can see the most dominant words here are really focusing on being compassionate, being supportive, being caring. And so we'll chat about that in a second, but keep going for a few more moments. Great, thanks. There's been about 120 of you chiming in, and the number's still growing there. Thank you so much for sharing these. So you can see here, and keep typing as I speak. We've done a good sense of the values that you're bringing to the sector, the why of your work. And then here we're really, I think, exposing the description of the community service, social services sector that also holds you here. And I invite all of you to just privately, because we can't, of course, hear you during this session, to think about, as you see all of these words, there's such diversity, right? There's people writing about compassion. There's people writing about the need for care. There's people who are writing about the fact that the community social services sector is also complex, and one person has said broken. So there's a balance of words in here, but at the heart of this word cloud, you can see that the majority of you, or the majority of the words that are being used, really focus on supportive, caring, compassionate, advocacy, empathy, and inclusion. I invite you to just think privately, and if any of you want to comment in the chat, feel free, and Erin can track this, as given these words that you've used to describe the sector, what are your hunches about why mental health claims are on the rise in our sector? Why is it tricky to improve mental health amongst ourselves in the sector? So just given that all of you are saying that the sector itself is supportive and compassionate and caring, the challenge I think that lies in front of us is how do we extend that to the workforce that's within the sector? And that's really why the time is now, as Sherry and others will say, to do this work. So we have one last one of these before we take a 10-minute break in a second. And thank you for getting us underway in such an interactive way. So the last one here is, let me just move that. Thank you for doing those pieces. So this one here, and this will help inform our conversation in a few moments. The question that I'm just about to pull up on the screen is an invitation for you to think about the skills and abilities that you bring. So this is an opportunity to take stock here of the skills and abilities that you bring to your work in the community social services sector. So we've done values, we've done what the sector means to you. What are the skills and abilities that you bring to your work in the sector? We'll just let that sit with you for a few moments. It's always trickier to think about the skills that we bring. I'll scroll up here. Thank you for sharing so many of these. What a talented and skilled group all of you are. Just look at the diversity of skills and abilities. Good to see some of you referencing laughter. Important references to insider perspective regarding being Indigenous and cultural, a person who's Indigenous and a cultural person. Just giving you a glimpse into the people you can't see this morning. This is our attempt to help you feel some connection to each other. So many of you talking about the big picture, having lived experience. One of you LOLs and says that you have 1 million kids. We've got almost 200 of you sharing your skills and abilities. I'll give it another 30 seconds. Pragmatism, always good. So I'll just leave this up for a second whilst I just kind of bridge into, we'll be taking a 10-minute break before we move into kind of a training segment for you. the reason I did this activity with you, A, was to try and connect us together, because I think all of us, many of us in community social services, if we're in front line, have been in offices, we're in essential service. And so we've been together, but it's been frenetic, it's been busy, it's been tough. And so we really wanted to give a sense of connectedness here. Imagine that that SAT is hosting us at a lovely space somewhere, and you'd had the opportunity to do this. We wanted to connect you because for us to make any progress in the area of workplace mental health, we have to build connection. We have to do a better job of that. The second reason I wanted to do and Sherry taught me this, is to really start at that value start. So connect with your why. Because for us to think through workplace mental health, for us to, as Heather was saying, really get to the value proposition, the rationale for spending on this, we have to connect to the why and the need to protect the why because it's precious. Your description of the sector in that second activity gives us a sense of the sandbox we're in, the context in which we're in, and what needs protecting there as well. And the things that we need to do to experience collective resiliency as we move through these next phases, and that's why we're tackling workplace mental health together in our sector. And then thirdly, the other thing that's so critical is for change to happen, we need each of you to be agents of change alongside us. And so just to take a moment to think about the skills and abilities that you bring to this work, I think is incredibly important for you to see. And just look, we've had 214 comments. 214 of you have weighed in on your skills and abilities. And I hope you're taking away from this activity. And I think the Federation reminds us of this, and CCIA does, and the union side, that this is an incredibly talented sector that needs a light shone on it in the context of the skills and abilities that you can bring to improving workplace mental health. We will make this available to all of you after today's session, so you can many of you, if you're a child and youth care worker like me, have done the warm and fuzzy activity when you're working with kids and the kids are leaving the group that you've been facilitating. I used to do this in the PEACE program when I was an early child and youth care worker. And all of the kids would put these on their fridge. You'd need a really large piece of paper to put this on your fridge, but to put it on your fridge and just remember the company you're keeping in the context of the skill and talent that we're going to need to really turn the corner on workplace mental health. So it is that time. I'm just going to bring up the slide here. We are going to give you a 10-minute screen break. So I'm just going to pull up the slide here. So it's 10 after 10, right on time, 10 after 10. We're going to let you just digest what you've just experienced interactively, and we're going to regroup at 10 past 10. So come back at 10 after 10. Do what you need to do. Grab a tea, a coffee, grab some fresh air, close your eyes. And at 10 past 10, Erin's going to walk us through a teaching segment on checking in and supporting staff who you might be concerned about. SAT has also launched a poll here that you can do at your leisure. It's showing up on your screen. Just if you have a minute before you come out to the break, if you answer that poll, that would be very, very, very helpful. See you at 10:20. Okay, welcome back. It's 10:20. I hope you all had an opportunity to take care of yourselves, grab a tea or some water, and maybe a bit of fresh air. It's super beautiful, at least here on Lekwungen speaking territories this morning. Before we hand things over to Erin, I just want to bring one more voice into the mix here. I want to bring Shairoz Jinnah, who's the Director of Counseling and Child and Family Services at Archway Community Services, to share her perspective on this idea of achieving workplace mental health. So we're just going to play this short video before we turn to Erin.
Workplace employment, mental health is so important to me, especially because of the 18 months of COVID that we've been going through. And like just to feel the energy in the workplace where people feel happy and they're talking about great things happening and they're looking forward to doing something rather than feeling like so weighted down. And if we were able to, people were able to address their workload issues, they were more manageable. There was like more tolerance in their balance in their daily lives of trying to find, what are some of the innovative things I can do more of rather than just the day to day, because they're so depleted. So we want to see that shift in terms of energy and what people feel like and they do. The fact that they can openly and safely talk to their supervisors about their mental wellness issues, they feel comfortable. They want to do, like, we'd have so many more lunch and learns around mental health and what it means to you, and how can you support each other, and what would that look like? How do we reach out to our external agencies and collaborate with them so our staff have people they can work with and they're not feeling alone and overloaded when they're dealing with complex and difficult situations, and they're the community of practice that everybody's excited about and wanting to just develop it and grow it. If there was some kind of not something to dream about, but life coaches built in to everyday work, and that people could, get direction and career support, like people in culture instead of HR. And so we're changing the language as well in terms of how we think, how we work, and how we support each other. So I think
Johnny, you seem to be muted.
Oh, there we go. That's the first one, Erin, this time. Just want to say thank you to Shairoz for sharing those thoughts of Shairoz's vision for workplace mental health in our sector. Good to see some of you engaging with the challenge that was set earlier. So we'll keep an eye on that. Erin, I'm going to hand things over to you. I'm going to go off camera and I'm going to share the PowerPoint slide. So stop video and share.
Perfect. Great. Thank you, Johnny. And I'll check with you. Everyone can hear me all right? I'm going to assume that's a yes.
Yes.
Perfect.
Yes, yeah.
Great. Awesome. Well, thanks everyone, and thanks for sticking around. We've got a little bit of time left to go. Johnny is a tough act to follow, but I am going to do my best. CMHA has a ton of different courses and educational workshops about psychological health and safety at work. And so, it's a bit of a challenge to decide what we wanted to present to you today and what we wanted to focus on. But where we landed is just a little micro lesson, so to speak, on checking in and offering support. So whether you are a manager or supervisor, or whether this is colleague to colleague, we really wanted to focus on that. And I've got just some overview of our responsibilities and some different tips and tricks as well. We can normally talk about this at great length. So as I said, this is going to be a bit of a short overview, and hopefully there'll be some questions or comments in the chat. I'm going to go through a few slides here. Johnny's going to be my slide advancer, and then we are going to do just a quick role play afterwards. Again, please do not judge our acting abilities, but hopefully that'll help to make some of this land a little bit. And a really important thing here, as Johnny had mentioned, is how do we take our personal values, the values that we bring to work, and how do we apply those within the workplace? So we know that all of you are doing absolutely wonderful, caring work with your participants, your clients, your tenants. But how do we also make sure that we can apply those same skills, those same strengths amongst our colleagues as well? So Johnny, if you want to move that ahead. So this is my brief overview. First, we're going to just consider what is our role. So our role might look a little bit different, even though our conversations might be very similar, whether we're a manager, supervisor, or colleague, especially if we're doing very early check-ins with folks. We still want to make sure we know what hat we're wearing, right? What is my role? What is my responsibilities that fall from that role? Because again, we want to really make sure that we are acting with empathy and also with professionalism. I'm going to quickly talk about some workplace trends and the questions that have been raised by the pandemic. I unfortunately do not have all the answers to these questions, but I think they're important things to keep in mind for the next few months at least, if not longer. And when I talk about workplace trends, this is what I'm starting to see and hear from engagement with your sector and with others, as well as from within our own workplaces. So again, as Johnny said, we are in this sector with you. We are doing this work as well. And so I think hopefully what I've started to notice also resonates with you. And then I'm going to get to the meat of everything. How do I actually do these check-ins and offer support? So if I have noticed that there's been some changes, if somebody might be struggling, their work's a little different, or their relationships with others seems a little bit different based on the strengths and skills that I know that they normally bring to the workplace. How do I bring that up? How do I do that in a way that helps to open the door to conversation, still stays within my boundaries and that role that we're going to talk about, but helps somebody to feel supported, like they can go that next step, whether that is through workplace supports that are offered or through external community resources. And in some cases, we might find that people really just needed somebody to listen to them, right? Somebody just needed to know that someone is paying attention, somebody cares, and that might be enough for a lot of folks. So these are the things we're going to go through in this next about half an hour together. So next slide. So again, your role will impact what your responsibilities are at work. So I know that everyone in this call is coming from slightly different positions and very different organizations. But generally speaking, when we look at the employer's duties to staff is just at the most base level. First, to ensure a safe and non-discriminatory environment. So this is really kind of that bare bones, most important. Hopefully we know this already. As well as preventing and addressing bullying and harassment. Of course, we have to have our clear policies and procedures around that, what our protocols are, and then to provide accommodations as necessary and then also as feasible. And we could talk about accommodations and the duty to inquire and accommodate for hours and hours. So again, I can only just make a couple notes about this here, and hopefully we can follow up and provide some places for more information around this. But as I said, these are kind of those bare bones duties that employers have. And of course, how this actually comes about practically, employers are often doing this through their managers or an HR department if they have one, or with their managers and HR department if they have one. And another important note here that I've made is also this idea of managing perceptions about accommodations. So oftentimes when I go to a workplace and we're talking about what accommodations are, helping to keep people at work or to return to work so people can get back to that level that we expect of them. They can use those skills and strengths that we know that they have. Sometimes there can be a little bit of, the water cooler sort of situation around accommodations, or people saying, why does that person get something that looks a little bit different than what I get, right? Why was there an adjustment made for them, whether that's for their schedule or for their workload? Why does that happen for them and that's not happening for me? So although this might not be one of those kind of bare bones, really clear cut responsibilities that employers have, I do like to just bring this up and make sure we're aware of this, that if we're doing a really great job ensuring that people have accommodations, whether those are for physical health reasons, psychological health reasons, that we're really setting a tone in the workplace around this is, again, it's not an advantage. This is about making sure that people can stay at work or return to work and be that part of the team that we know that they can be and expect that they can be. So if you are a team leader, supervisor, manager, just really being aware of what that perception is around accommodations in your workplace and setting that tone and setting that expectation that if people need accommodations, we'll have that conversation about it and we are going to implement those as needed and as necessary. And the reason that we're doing it again is because it really does tie to those values of making sure that everyone has an equitable opportunity to shine in the workplace and again to do their best in the workplace. Next slide. And then, of course, everyone, absolutely everyone, whether you are in a leadership role, formal leadership role, informal leadership role, you are an employee, you're brand new to the organization, or you've been there for 20 years, regardless of your position, our expectation, and increasingly this is an expectation from everyone, is that you're going to try your best to promote a positive culture and to treat people with dignity and respect. Although this presentation is going to get into how we speak to somebody in a specific situation when we have a concern, those in the moment conversations are just one piece of the puzzle, right? Really, we're hoping for early health promotion, right? Just we speak this language externally all the time, but we want to really build that healthy culture so that we're noticing sooner if people might be having a challenge at work or a struggle in their personal life that's affecting their work. We want to notice sooner to be able to help people have those conversations and also be able to have those open and honest conversations, because sometimes I'll go in and maybe I'll do a lunch and learn or another presentation and I'll talk about these supportive conversations. And I might have a manager who says to me, well, I try to do this, right? I think I am asking these questions. I think I am talking to people, but they're not telling me things, right? Or they're not opening up, or they don't seem to feel comfortable around me. And part of that might be actually a bigger piece of our workplace culture, right? Some of it might be personal, but some of it also just might be that employees really aren't sure what's going to happen next, right? If I do disclose anything, or if I am vulnerable in a conversation, will I still keep control over the situation? Will I still be able to make choices and decisions? Will I be put in a box or have a label put on me, right? So people really need to know, and they'll know through action whether you are trustworthy, whether the culture is actually respectful, and whether everyone's dignity is actually appreciated. Right? So part of that will come through things like clear communication. This is part of, there's many parts of this that are embedded right into our national standard for psychological health and safety in the workplace. And clear communication means being straightforward when you need to be. So sometimes we think that being very nice, very polite is the same thing as being very kind to people, when actually sometimes we really do just need to be straightforward, right? Especially if somebody doesn't realize the impact that the change might be having in the workplace. So we want to make sure that we are clear and direct when appropriate, when needed. Timely communication, so change, process. Again, the pandemic provides many examples of that, right? As we have a restart plan. So the change in the processes, things that are going to affect people at work need to be communicated in a timely fashion. And again, in a very clear fashion, and oftentimes more than once. So not just an offhand comment as you passed somebody in the hallway, but thinking about what really is the best way for this message to get to people. And how do I ensure that the message did get to people, right? That it is understood. That's a huge part of clear communication. Our boundaries as well. And this one can be a bit of a challenge, I think, when we're helping people, right? When we are supportive people by nature, when we have this really strong value of empathy, there can be times where sometimes those boundaries get a little bit blurred because of good intentions, right? We want to take on more and more. We want to help, we want to solve, we want to even fix sometimes. And again, as soon as I say that word fix, I'm sure a lot of people behind their screens cringed a little bit, because we know in our work that we're not trying to fix anyone. And yet, sometimes in the workplace, in these interactions, we forget that, right? Or we don't have that same clear boundary. So remembering in our supportive conversations with folks that we are a colleague or a manager or a supervisor. We can care about people beyond work. We absolutely should care about people beyond work, but it doesn't mean we have to know everything that's happening outside of work for folks. And it doesn't mean that we have to become somebody's counselor. So even if you are a counselor by trade or by training, you are not your co-worker's counselor, right? So to remember those clear boundaries, what do I need to know? What do I not need to know? Using those same skills, maybe things like gentle interruptions, and then also about very clear and careful decisions about self-disclosure, right? So a little bit of self-disclosure, I've been through something similar. I've had a really tough time. Here's what worked for me. A little bit of that can absolutely help to reduce stigma. It can help people to feel more comfortable being vulnerable, but we still want to make sure that we're not accidentally making the conversation about us, right? Or now we've switched the role and that person we're trying to support feels like they need to support us. Or maybe we shared something actually just far too personal in the workplace. And once we've done that, it's kind of hard to take that back. So making sure that we have our boundaries and we also help the person we're trying to support to maintain their boundaries as well. So not probing too much, really just asking about what do I need to know here in this workplace to support you. And then about building trust, and this comes through action and time. There's no shortcut to building trust. In workplaces where maybe our culture has had some challenges, maybe there's been a ton of change or a ton of turnover, you can't just snap your fingers and have a trustworthy environment. This will take time and you have to be consistent in your actions. So yes, you might try to have some of these supportive conversations sooner. They may not go exactly as you want them to go or as fast as you'd like them to go at first. But over time, you've also demonstrated that you are a caring person. You are a person that someone can come to. And so hopefully over time, it becomes easier to open up to you. All right, next slide. And before we get to exactly how to have some of these supportive conversations, I don't think I have to build a huge case for why. We're all here still on this webinar, about an hour and a half in. I don't want to belabor why we think this is important. And of course, again, we think that this is all important for supporting our participants or our clients or our tenants. But we are seeing that this is a major trend in the workplace. We heard at the beginning of this webinar that this is a topic that's probably more important than ever. So there's a few different trends that I am noticing, and you can let me know maybe in the chat if you're experiencing them as well. I see some people are having some challenges with sound cutting out, and I'm not sure exactly what might be causing that. So if it's a consistent problem, let me know. And if it's perhaps on your device, then maybe Matthew can help you sort that out. So for trends in the workplace, what I'm finding is that there's a broader understanding now of psychological demands, hazards, and injuries. And what I mean by that is, I think increasingly we're understanding more about post-traumatic stress disorder as an example, but still really tying that to those kind of stereotypical examples of in the moment panic situations or safety situations, those really dramatic emergency situations, I think tends to still be the way that we think about psychological injury or psychological hazards at work. But I'm finding that we're really starting to have a broader understanding that there are psychological demands in every single job that's out there, every single job. And being in the community social services sector, and actually amongst the different workplaces in this sector, there's going to be several different psychological demands that may be unique to your type of work and to your specific workplace. And so part of psychological demands is similar to just how every job has some sort of physical demand, right? Whether that is standing for long periods of time or having to lift something or push something or staring at a screen for hours, whatever those physical demands might be, every job also has psychological demands. And some of those might be things like our soft skills, right? Our customer service skills, our people skills, the empathy that we have. We know that many people in caring and caregiver roles are experiencing high levels of stress, anxiety, burnout because of those psychological demands of the work that we all do. And so with this broader understanding of psychological demands, the sorts of things can have a wear and tear on us if we are not supported properly, if we are not able to practice our self-care strategies. We're also seeing an increased expectation from employees. And it's really tempting and easy to say that this is a demographic change, right? This is an expectation only from younger workers, but that's not necessarily the case, right? Certainly we are seeing that younger workers are expecting a workplace to care about them as a person, right? To see them as a whole individual. But we're seeing this with workers of all ages as well. So we don't want to make assumptions about who expects us to prioritize psychological health and safety at work. And so again, part of that expectation is that my employer is going to help me to find some balance or some wellness between my personal life and my work life. There's going to be opportunities to be able to debrief tough conversations. I'm actually going to be onboarded and professionally developed, right, and trained to be able to handle the psychological demands at work instead of having them show up and be a surprise, right? Or for having people to tell me that I should just pull up my bootstraps and everyone deals with this, right? Everyone has to get through these sorts of situations. So increasingly expected that folks will be supported in these interactions or in these tough times. And then we're also seeing a focus on prevention. So yes, it's one thing to address a situation that's happened at work or, again, an emergency situation at work, but we also really want to make sure that there's a good foundation at every workplace that is preventing those hazards and those injuries as much as possible. We probably can't prevent everything, but as much as possible, or at least being sure that there's a clear roadmap for folks. Once they have been through a tough time, they have had a struggle, how do they get back on track? How do they feel well afterwards? And just as an example of that, you can check out WorkSafe BC's psychological safety initiative if you're not familiar already. There's some good information on their website about that for the 2021 to 2023 initiative. So really a huge focus on prevention there. And so as employees and as managers or supervisors, if we could start to prioritize this, we're going to really be ahead of the curve, if anything. All right, so thanks, Johnny. Next slide. And then just a few questions raised that I think would be good to keep in mind for the next few months or longer. As I said, I do not have the answers to these. If you have any thoughts, again, please feel free to put them in the chat. I'd love to hear if you have some answers or if there's some things you've already kind of ruminated on. But a couple of the things that we're starting to hear, I'm starting to hear from employers and employees, is this idea of what processing trauma, grief, and chronic stress from the pandemic is going to look like. So I do know that many people have essentially been white knuckling through the last year and a half, right? You've just tried to get through. You keep setting these milestones of, well, next month things will be different, or 2 months from now things will be different. And we keep setting this bar or this moving pylon that we're trying to get to that's helping us to get through the here and the now and the difficulties. And some of us maybe haven't had a chance to actually take a deep breath, right? Think about what's next. Think about what's also just happened. So I don't know exactly what this is going to look like, but there seems to be a lot of agreement that at some point here, if things are really getting back to normal, right, back to opening up, back to regular social interaction, will we collectively need a moment to just take a deep breath, right? And what happens if people are all at different stages of this, which they likely will be, different stages, different places, different experiences? What is this going to look like for us as individuals, but then also as a society? And as a work team, what is this going to look like as we all need to take a sigh, take a deep breath, and figure out what's next and what did we all just go through? And then many of us, of course, are going to experience this as grief, as confusion. Some folks, especially if they didn't feel supported, they might feel some feelings of resentment, right? I didn't feel cared for. I didn't feel supported. Sadness, right? People didn't do what I expected. They didn't rise to the occasion in some cases. Of course, we know many people did, but if your personal experience is that some folks didn't, or maybe you learned things about people that surprised you, and you just feel generally disappointed about some things. How is that going to look in the workplace? How is that going to look for different sectors and different industries, right? If people are feeling like things were not managed very well, there's going to be some additional layers of emotion there. Another question that's coming up is how do we apply learning to improve safety for frontline workers? So there was a lot of challenges, especially at the beginning of the pandemic, right? Of things around PPE, getting those clear policies. And of course, there's a lot of good reasons for that, right? There's a lot of unknowns. Many of us found this very unexpected. We really learned, again, a lot more about compassion fatigue, right? Those difficult situations that many frontline workers are faced with. For many, of course, this shouldn't be a surprise, but I'm talking very broadly here about society, things that we maybe learned about frontline workers or frontline jobs. How do we make sure that we keep up the momentum here, that we keep this front and center, that learning actually informs what we do in the future? And this is a job for all of us, right? To whether we're frontline workers or not. In fact, if we're not in particular, I'm hoping we can step up here. And how do we make sure that that momentum continues and we engage people to make sure that frontline workers are supported for the rest of time and not just during things like a pandemic? And then lastly, what challenges are going to emerge with increased work from home or hybrid work? And of course, there's tons of benefits with work from home opportunities and hybrid in the office and at home work. And I'd be a huge hypocrite if I didn't say that I know there's tons of good opportunities and good things here. But with every opportunity also comes some challenges and some more learning that we're going to have to do. So how are we going to keep up a healthy workplace culture? How do we keep people engaged? How do we continue to have really strong communication and regular check-ins when people are in different places and spaces at different times? And how will our work maybe even look a little bit different? So just some things to keep in mind. And if we can start to try to answer these questions, again, we're going to be in a better place in the future. And next slide. Okay, and usually at this point in any presentation or workshop, as I've said, we talked a lot about our culture and how this is a journey, and there's lots of good things we have to keep doing. And as I mentioned at the beginning, these in-the-moment supportive conversations, that's just one piece of the puzzle here. And yes, or yes, but most people say, okay, I get that. Yes, we need to work on our culture. Yes, there's a foundation we have to build. But also, what do I do when it's in the moment? What do I do if I am concerned about somebody? How do I have these conversations that tend to take up a lot of my brain space? And I really want to say the right thing. I want to do the right thing. So I will get into that. So again, if your role is as a manager, it might look a little bit different, right? There's that duty to potentially have an accommodation if there is a health issue or a health concern at the root of the changes that you're noticing in an employee. And part of the whole idea of accommodations, before that comes this duty to inquire. And again, we could talk about this for hours, but essentially you won't know if somebody needs an accommodation oftentimes unless you've opened the door to that possibility or you've asked. Of course, some employees will be very good at advocating for themselves and will be able to let you know what they need. But oftentimes, especially when we're talking about psychological health, because there is still so much of this stigma or shame or taboo around about raising your hand and saying, hey, I am struggling with something, or hey, things have changed for me. Because of that, oftentimes we're going to have to be the one as a manager or a caring colleague who just opens the door to that conversation, right? Says, this is safe to talk about. You are supported here. So if you are a manager, and I'm being very vague here about changes, because again, we could talk about this for ages, but changes in the employee's usual strengths, their usual skills, their usual relationships with people, just changes even in the places and spaces you expecting them to be as you get to know them and you get to know their job and how they do their job. If we start to notice changes, especially if it's affecting how they can do their work effectively, or if it's starting to have an impact on the team, we really want to make sure that we're bringing up what those changes or those concerns are sooner rather than later, and not in an accusatory way, but coming from a place of, I want to be able to help you to do your best work, right? I care about you as a person, and I've noticed because I've paid attention that there are some changes. So you want to bring up those concerns. Ask how you can provide support. Some folks will know right away what they really need, and they've just been trying to think about the time to ask you. And then other times we might have to explore this together, and we might not have all the answers right away. If there could be a health issue, you want to again have that opportunity to inquire if there could be a health issue, and then also to discuss any accommodations that might be needed. And then connect with the appropriate resources. So again, this is not just on you to be the problem solver for anything that's coming up, or to have to say yes and have all of the answers right there in the moment. So connecting with the other resources that would be there, whether that's employee family assistance plan or some of the things that Johnny and I are going to talk about afterwards. And then of course you'd want to have some documentation that this conversation happened. And documentation really is just the facts, no assumptions, just what did we talk about? When did we talk about it? What's the follow-up? Right? What are those next steps? And this is partly so, yes, of course, you can say that you did have the conversation, you did inquire if necessary, you did start the conversation about accommodations, but also just for your own memory, right? We're busy people. We want to remember that we made a commitment to somebody, and then we want to be able to reconnect and pick up where we left off. So we could go into each of these steps in far more detail. This is maybe a little bit of a plug for some of our other training and workshops that we have, but this is kind of the outline, the skeleton of the things that we want to make sure that we cover in a supportive conversation. And then when Johnny and I do a quick little role play here shortly, we'll play out a couple of these different things to hopefully help make it land for you. So if you're a manager, this is roughly what the conversation would look like. And next slide, Johnny. And then regardless of if you're a manager, supervisor, team lead, or someone's colleague, their coworker, if you do notice changes, there's some important things here to keep in mind. And of course, if you're a colleague, you don't necessarily have those same duties, right? It's not up to you to explore accommodations with somebody, but you could still check in. It is still your business if you are concerned about somebody and you care about somebody. It is still very much everyone's business to have a caring conversation, a supportive conversation, just a quick check-in with somebody even. But regardless of your role, we do want to make sure that we, quote unquote, stay in our lane, right? So even if you are a counselor, remember you are not your employee or your colleague's counselor. You are there in that role wearing that hat that you have. And I always like to talk about watching out for shoulds, right? So you should do this, or you should have just done that. Watch out for any time you're starting to say should. That's a pretty good sign to us that perhaps we are crossing that boundary. So we don't want to give a ton of advice to people. We don't want to say, this is all you need to do, or this is all you should do. We really want this to be a collaborative conversation as much as possible. So that person still feels empowered to make decisions for themselves, to be able to speak up for what is best for them. When we say all of the things that you should do, we give too much advice about things. It actually creates that power imbalance or that hierarchy, right? It essentially says, I know what's best. I know what will work for you. And I'm imagining we try not to do this when it comes to our participants or our tenants and our clients, but we sometimes again start to do this when it comes to our colleagues, our family members, our friends. We just go into advice mode, and we want to make sure that we don't do that. Next slide. And so some helpful tips when we are having these conversations, again, regardless of your role, I really like to try and take a strengths-based approach. I love that Johnny started with this activity of what are our strengths and our skills, because this is actually what's going to help to notice changes in somebody, right? Because if somebody is now not using that strength in the workplace, or that strength isn't shining through, that might be a sign of that there's a change, right? That they're not being able to use those strengths. So if normally somebody is very patient, they're an active listener, like we saw in some of those Mentimeter feedbacks that you gave. If somebody is now being a little bit short with people, right? Or they're jumping to conclusions, or they're brushing people off, and that's not like them. We know that that's not like them, and so we can lead a conversation with the strength that they normally show or that they normally have, right? Normally you're so patient, right? Something has changed. Being direct, as I said off the beginning, it can be kind. So sometimes we might just be like, how's it going? Right? Have things changed? What's going on? And sometimes we actually have to be more clear cut than that. What is sometimes the specific thing that I've seen or that I've noticed? And then also, sometimes we're really quick to try and give answers, right? Give solutions, make promises that we maybe actually can't keep in the long run. So it's really important that we ask for time and space to process if somebody shares something difficult with us, or if they're asking for an accommodation or some change to their work. We can always say, let me think about that and come back to you, right? Or let me look into that, or let me talk to somebody who knows more about that. Or would you like to talk to somebody who knows more about that? It doesn't have to be all on you, and you don't have to make a promise right in that moment. So opening the door to these conversations doesn't mean that you have to say yes to everything. And then debriefing those difficult conversations yourself too. So who are the trusted, safe people you have that you can go and lean on for support? So we often in our roles in the community social services sector, we give and we give and we give, but who can support us? So don't minimize the impact that even just a quick check-in can have on you. And if you really care about this person, if they've disclosed something very difficult, whatever the situation may be, please make sure that you're still actually taking care of yourself and finding those people who can support you as well. Next slide. And Johnny, is this our cue to do our role play?
Yes, I thought this was a great role play picture.
It is. It is. Great. Okay, so maybe I should set our scene here a little bit. So this is, we're going to go through two scenarios here pretty quickly. And again, in the chat, please feel free to put any feedback that you have or ideas that you may have. So we're going to go through one. I think you're going to have a sense that maybe this is not lining up exactly with some of the suggestions I have just made in our little micro lesson there. So in this situation, I'm going to be the manager and Johnny is my employee. Again, we are not trying to win any awards for our acting here, so please go easy on us. We haven't done role plays for quite some time. So I'll be the manager, Johnny's going to be the employee. We're pretty much just passing each other in the hallway. We're going to have a brief interaction, and then we'll do a quick little debrief of this one before we go on to the next one. So, Johnny, are you ready?
Yeah, I'm ready for my Oscar-winning performance.
And everyone, all the participants, you're buckled in for this. Oh, I see people are starting to notice things. Yes, they're starting to notice your challenge, Johnny.
Yes,
Wonderful.
yes.
Great. Okay, so we'll start this little role play. We'll start the scene. All right. Hey, Johnny, you seem a bit off today. Is everything good?
I'm fine, I guess. I'm fine. I'm fine.
Okay, you're fine. Well, that's good to hear. How are the kids doing?
Well, actually, Erin, my son's really, really struggling with anxiety at school at the moment, and
Oh,
um,
okay.
and I really don't know what to do. It's like it's really hard at home, and he comes home and super anxious. My partner and I, we're just at a loss, and I'm just finding it really hard to concentrate on my work.
Oh,
Yeah.
okay. Yeah, no, I've been there. I've done that. I totally understand. Yeah, at lunchtime, can you come remind me? Just come poke me on the shoulder or something. I have a great tutor that we used for my daughter. Excellent tutor. I'd love to just give you the number. I think that might work for you. That might solve your problem. So yeah, come find me at lunch. If there's anything else, let me know. I've got a webinar I got to run to though right now. So yeah, come check in later. Give you that number and yeah, thanks. Talk to you later.
Thanks, Erin.
Okay, so that's our first little role play there. And oh wow, we're getting accolades. Thank you, folks in the chat. So of course, I think all of us were probably cringing a little bit about that interaction. But Johnny, I'd like to just ask you, how did that kind of feel to be supported by that manager?
Well, and I know this will be like super evident to folks who do this every day, but I think it was a helpful reminder of what it feels like to be interrupted. Like I was actually really imagining having an anxious kid and having a hard time at work, and I think you felt a little too advicey. You were just ready to solve my problem right away, Erin, and I was actually wanting to chat with you for a little bit.
Yeah, but I mean, the tutor worked for me, so I don't know why I won't just solve what's going on for you. It sounds like that should be an easy fix. Was there anything you think that maybe the manager was trying to do, or was, maybe there was still some good intention or things there?
Yeah, I think for our wonderful community of listeners this morning, I think the really good thing, even though you came in like a missile, was that you noticed, like you practice good noticing. And I think in the workplace, I feel this as a leader, I'm sure many folks on the call do, you worry about those first words, right? Like opening the conversation. And so you noticed, you said you seemed a bit off today. All good. So you opened a door to a conversation which, as I mentioned in my own life story, was game changing, right? Those conversations can be really powerful. So I thought it was great you noticed, Erin, and you leaned in.
Yes, I think maybe opened the door, but then started to kind of close it on you as you started to open up, if that would be fair. So that door wide open, and then as you said, you were ready to chat, but I think I was kind of inching it closed until finally I had to go run to a different webinar. So kind of shut that door on you, metaphorically. Yeah,
So you kind of bolted through the door and then ran out of the door.
Yes, as soon as we started to actually talk. And I'm going to open this question to Johnny, but also in the chat, just off the top there, is there anything that could have maybe made that conversation a bit more supportive? Even just some quick things that we maybe noticed right away. So to Johnny, but also in the chat, is there anything that would have been helpful there?
Well, I think it's good. It's a good remembering, like not to leap to advice giving, too quickly, not to leap to a solution. And so many of us are in jobs that require fast solutions. And so I think, sitting down or maybe saying, hey, is there a more private spot we can chat? Might have been a way to kind of break this, but you might have actually been running to a webinar. So I wonder how you'd handle that. That'd be a good opportunity for our listeners in the chat. The chat's on fire right now with some really good suggestions here. Yeah, but maybe just making a bit more space and maybe saying, yeah, thanks for sharing that. You know, do you want and seeking my consent, right? Do you want to share anything more? And we can make time to chat this through if you like. Probably would have helped.
Yeah,
Oh, and
thanks.
Priscilla's sharing that too.
Yeah, we're getting some great ideas here in the chat, right? So having that active listening, empathy, paying attention to your body language. And I get this, I ask this pretty often, right? Well, what if I'm over Zoom, right? Or WebEx? How do I have these different conversations? But you could still see from Johnny's body language, right? Feeling a little bit almost like overwhelmed, right? Or maybe a little defeated with the situation. So the body language is important. And then I think one of these consistent pieces of feedback here is actually making a time to chat. So maybe if I knew I had to go run off to a webinar in 5 minutes, it wasn't the best time to do that check-in, right? So yes, I showed I cared, but I really wasn't actually prepared for a real conversation. So making sure we actually have that time set aside. So thanks everybody. Lots of feedback in the chat. Yes, people are sending it just to the panelists. So we're going to try to summarize those comments for you as they come in. So thank you. Okay, so we'll do another one. We'll do a second one before we send people off to a break here again shortly. So
Just have to refresh, Erin. I'm just going to turn around.
refresh. Yep.
Ready to go.
Screen.
Out of roll into roll. Here we go.
Yes, perfect. Okay. All right. So same situation. I am still Johnny's manager, and Johnny is my employee. So, hey, Johnny, thanks for making time for this meeting. I wanted to check in and just see how you were doing.
I'm fine. I really am. I really appreciate your time, Erin, but I'm doing okay. I'm just worried about my kid. That's all.
Okay, so you're worried about your kid, but you said that you were doing fine. But I've noticed you haven't quite seemed like yourself the last few days, actually. And the other day, I even saw that you were a little bit short with one of our program participants. And normally you're just so patient and you create such a great atmosphere. And it just seemed a little bit different for you to not really have the time for somebody. Can you just maybe tell me a bit more about how I could help with this or how I could support you?
Well, thanks for asking, Erin. My son, Josh, he's having a really hard time at school. He's really struggling, really struggling, and I think I know what it is. I think he's super anxious. He's really anxious. Um, and I just don't know what to do about it. I'm finding it really hard to concentrate on meeting with the clients here and running these groups. Like I'm running these groups with kids who are anxious too, and my own kid's anxious. So I'm just feeling I can't be present to do the group work here at the community center. So I'm just not sure where to turn. I don't know where to go. I don't know where to go.
Yeah, well, thanks for sharing that with me, Johnny. That sounds, very stressful that your kid is struggling, and maybe you don't really get a break from that if your work feels very similar, right? You're trying to support lots of young people right now, and at work and at home. So thank you for sharing that with me. I know you said you don't really know where to start or what could be next, but do you have any ideas about maybe how I could support you at work or through the workplace? What would be helpful?
Well, that's a good question. Like, you're meaning like where we work, like my job. Is that what
Yeah.
you're meaning?
Yeah.
Well, there's a tutor. There's a tutor. Some random colleague suggested a tutor, and so there's a tutor I'd like to hire. But her hours don't work with my work hours. They don't jive really. My shift ends 30 minutes too early, so I can't get my kid to the tutor. And I don't know if the anxiety is about school. We thought we'd start with the tutor and maybe then look at other things because it takes so long to get a kid seen by someone about anxiety. And I think my caseload is too high. Like I've got, so many families I'm supporting, so many groups, and it's a bit much right now. And I can't give everyone the attention they deserve, and that's hard for me. It's really frustrating, Erin.
Yeah, no, I hear what you're saying. So again, thank you. Yeah, it would be very frustrating to feel like you're not being able to support people to the same ability you normally do. I get that. Well, I think you've given me a few good things to think about. I don't know what I can do right here and right now, but you mentioned the tutor, and your shift is ending a little bit late to be able to get your son to the tutor. Would you like me to maybe just at least look into the possibility of adjusting that shift? I don't know for sure if I can do that right now, but would you like me to look into that?
Yeah, I think that's a good idea, Erin. Thanks for being open to that, hey? Thank you.
Yeah, so I'll take a look and see what we can do about the shift, and maybe we could give that a try. As far as your caseload goes, I think there might be some strategies we could try, because I don't know if that caseload, the numbers have necessarily changed, but I think there might be some strategies we could try to help make it more manageable, and so you really do feel like you're giving everybody that attention that they deserve. Would it be okay if we check back in a couple days to revisit the shift adjustment if it's possible, as well as your caseload and some things that we might be able to try?
Sure. Yeah, that sounds good. That sounds good. Thanks, Erin. Thank you. Thanks for listening.
Yeah, thanks. Well, and I'll send you an invitation for 2 days from now. If anything comes up in the meantime, though, definitely, knock on the door or send me an email. And if you have any other ideas, bring them to the meeting as well, and we can definitely talk about that.
Sounds good.
Thanks. End scene? Is that how we do the thing? End scene?
End scene.
All right. Oh, we're starting to get some people in the chat. So I just want to acknowledge, first of all, that no example of a supportive conversation is going to be exactly the way that you would do it, or, perfect. The whole point of the role play is not to try and tell you exactly how you should have a conversation, or that you need to do what I did in that manager role. It's just to give you a slightly different way of approaching a conversation compared to that first example, right, where maybe we're a little bit rushed. So again, Johnny, I'd just like to throw to you, like, kind of how did that conversation feel?
Yeah,
Your
and
character.
remembering that these are very truncated, right? So there probably would be a bit more time elapsing. You didn't leap to solution too quickly, so there was a bit more exploratory. So I felt that was helpful. And I really appreciated as my boss, you didn't probe too much. Like you validated, you acknowledged, so I did feel heard and I did feel seen. But you didn't kind of get into the details. Like you respected my privacy, which I thought was really important. And then you started to pivot to other opportunities where we could start chatting and explore things. And I left the conversation feeling not shut down. I felt that there was an opportunity to have another conversation.
Great. Awesome. Well, thanks. And again, in the chat, if you have any other things that you would do or things that you notice, please feel free to share those. And I'm seeing that for the most part, people thought that second conversation went well. So that's great. And then I'll just kind of debrief as the manager in that position and some of the traps that maybe I have fallen into in the past, or it's still very tempting for me, based on my role and again, wanting to be helpful. So as Johnny mentioned, sometimes there's that urge to ask a lot more, right? To ask a lot more questions, to keep that conversation going for a long time before we go to solutions. So that's kind of the flip side, right? Sometimes we jump to advice giving and we jump too soon as well. And the other thing is sometimes we actually are delaying that because we feel like, oh no, I don't have the answers. And so I'm afraid to get to what the next steps might be or the next possibilities might be. Because what if, again, if I say the wrong thing or I don't know what's next, I'm going to lose control if I get beyond this part of the conversation. So definitely can be a challenge sometimes to find that right balance of what do I need to know? How does Johnny feel heard and appreciated? But then also we still do have to get to our jobs, and we still have to get back to what the workplace can and can't do. So finding that balance. So very tempting sometimes to jump to that advice or to probe too much. And also a bit of a attempt to go back to that self-disclosure piece as well, right? Like, oh, one time I also went through this, or this is again what I've experienced. So reminding myself, even in our role play, to actually sit and listen, right? Because you're always thinking about what you want to say next, and instead actually holding that space for that active listening, like we do with our participants and our tenants and our clients all the time, making sure we can also do that as colleagues or as managers and supervisors. So I'm also seeing some other comments in the chat. So yes, remembering not to be someone's counselor if you're not supposed to be someone's counselor. And then also some notes here about when close coworkers are supportive. Supportive as you allowed them to be. So we still want people to feel like they're empowered to have some control over these conversations, right? So sharing what they want to share, not necessarily any further, not having to take steps that they're not comfortable with. So on that note, Johnny, did you have anything else that you wanted to add about the role plays or anything we've talked about so far?
No, the only thing we would do next before we transition to the final segment of our webinar, we'll give folks a short break and then we'll move into the final chapter. Is I was just going to do a little post role play survey with our attendees to just gauge confidence. I almost did a pre-post, but I just did the post. Did you have anything more you wanted to add, Erin, at this point after the role plays?
No, I think that's good. Thanks.
Great. So we'll bring Erin back in a few little minutes. But Erin, thanks so much. And we clearly both have acting careers ahead of us if we ever leave the field of mental health. Maybe not. You do, Erin. You did great. You did great there. What I'm just going to put up on the screen here, following Erin's excellent teaching segment and the role plays you've just seen, is a final Mentimeter on this segment. We'll have one more at the very end. So let me just find my screen share here. Erin, is it showing up at your end there?
It is, yes. Oh, great.
Great. So we've got a little, this one you just have to navigate a little bit. So if you go back to menti.com and enter the code that you're seeing on the top of the screen, we would have done a pre-post, but we didn't want. So this will just be, oh, you've all figured it out. There we go. So if you hover over it, you'll see an option to kind of click a dot or a button there. And so you can see here the curve of the collective. We've got 30 people so far. Let's see if we can get to 100. Let's see if we can get to oh, it's going up really fast and zippy now. Let's see how folks are feeling here. So what you're seeing here with the line there, the line that says 4.1, it's the average of the ratings that are coming in from the group. And you can see most folks are kind of sitting in that that quartile at the end there. But let's see, we're at 94. Oh, jeepers. Here we go. Erin, look at the impact of our role plays.
Yes, it's definitely the role plays and not the strengths that everyone's already bringing to our conversation.
Absolutely, it's the strength of it. Wasn't the role play. It was absolutely the folks who are listening in here on the line here. So we'll give it a few seconds here. Good to see so many of you rating. So this was a scale of 1 to 5. Most of you are sitting, in a pretty comfortable place of having the conversation. And from Erin's comment, that's just fantastic news for the work ahead of us, around you feeling you've got a good baseline sense of confidence. We had a couple of comments come in. It really does depend on the relationship too. And I think the person who wrote that's bang on. If this is a new employee and you haven't built the relationship, you might respond a bit differently. So there is some context to this question. It's not a thoroughly fair question for you, but it's a crude measure of how you might feel if you're having a conversation with someone, if you're noticing any changes. Erin, as you see this come in, you're very knowledgeable in this area. Any thoughts from you as you see this curve on the chart, listening to understand?
Yeah, I think my first thought was that for the folks who are still saying they're not sure if they're comfortable or they maybe rated themselves a little bit lower than that at 4.1 average. First of all, not to feel discouraged. That's a very normal feeling to have. A lot of this is going to come with relationship building, as we saw in the chat, but also just through practice as well. And I find that's what's very helpful. And what's helped me as I went into management was to just, again, remember that I don't need to have all of those answers, right? I don't need to know everything in the moment. I really just need to pay attention to people, get to know people, open the door to supporting them. And then you have time. You have time to say, let me think about that, or can you tell me more about that, or turning to someone else for some solutions. And so I really encourage people to find who could be their mentor also in the workplace, right? Who can you lean on to help coach you in this area? And then also to just practice, right? The more of these conversations you have, the more you realize that they can go well, they can be calm, people can be actually very appreciative. The more that you do this, the more you have these supportive conversations, the more confidence I think you will get over time. And yes, again, context is important. You might have a situation where no matter your best intentions, it's just not landing. Maybe that relationship's not there with somebody. I completely understand that can kind of set us back in our confidence for a while. But to remember that doesn't have to be the norm. So let's build ourselves back up again. And again, debrief with somebody who can really support you and help you understand the really great things that you did and maybe those learning opportunities as well.
Thanks so much, Erin, and thanks for the comments. Some of you remarking you've been in the field for a significant amount of time. Your personality, your skills allow you to feel comfort, and that absolutely, as Erin's commented on, is an important variable. And some of you have given some lovely feedback on our acting ability. Someone said Ryan Reynolds would actually be jealous of our skills there, Erin. So we have one last segment, so we're gonna do one more break here, just to allow people just to rest their eyes for a few minutes and just catch their breath. We'll given that it's 11:15, we'll come back. We've got about 35 minutes more of content before we wrap up at noon. So come back at 11:25. Just do what you need to do for those 10 minutes. There is a poll question there if you have a second to have a go at that. And thanks, Sat and Matt and the team. But we'll see you at 11:25, and maybe Aaron, we could pop that in the chat. 11:25. Go take a break. Okay. Welcome back to the final stretch of our training session with you this morning. We're going to just run through some resource content and let you know about the work that we're going to be doing in partnership with the Federation and the Council over the coming months. And then we may have a couple of minutes for a few exciting things at the end. So let me just bring up the resources here. Great. Okay. Let's pull that there. Okay. So just to move through this final segment, Erin, can you be my
Got it.
Great, excellent. Some of you might see an active poll going too. We've really interacted with you lots. We've got technologically galore here. Technology everywhere, so that's great. There's a poll question that's open. Do take a look at that if you have a second too. So there's just two segments here. We're just going to walk through some of this. Some of this will be very familiar to you. Some might be new. The main aim here in following up with Erin's comments is to just explain the resources that are available out there right now, and give you a sense of where you might turn before we explain to you how we can support you as sector members with some of the training that's ahead of us coming into the late summer and into the fall. So here are a couple of websites and that you can check out. Erin, maybe pop the link into the chat. There's a bit.ly link there if you've got a sec, Erin. You could throw that into the chat for attendees. The province at the beginning of the pandemic stood up a virtual mental health supports listing. You'll see the date is December there. They've actually just updated it this month, June 1st. And when you go to that website, you'll see a full range of specifically virtual mental health services and supports that have been set up in the pandemic. These are resources that are free, publicly available, some of them offered by us, some of them offered by many partners, some of them offered by a number of you, particularly if you're a community counseling grantee or agency. So do check out that listing. It can add into the resource pile that you can offer your clients, but also within those services, particularly if you've exhausted your benefits plan, or if you don't have access to some of the health and welfare pieces as part of your benefits plan, these resources can help augment things for you. On the right-hand side of your screen, and this was promised to you in the abstract, the blurb about today, is a program that's worth emphasizing for you. It's Bounce Back. We operate this program at CMHA in partnership with our branches, and it's been underway since 2008. And it's human-powered depression and anxiety care. So it's not therapy or counseling. But it is an offering focused upon a coach. And you remember Shai Rose talked about coaches earlier. We've got a team of 20 coaches across the province who walk people through proven resources and proven materials focused on reducing anxiety, depression, stress, and worry. So it's a completely free program. It's not attached to an employer. It's confidential and safe. And it's completely free. And you can use the program as much or as little as you want to. And now, since the pandemic started, the province resources to allow self-referral. So as long as you've got a primary care person in your life, it could be a walk-in clinic, it could be a GP, it could be a nurse practitioner. They don't need to refer you, but as long as you've got some connection to a primary care professional, Bounce Back is available. And the beauty of it is that you don't have to go anywhere. You can use the resource from the comfort of your home. A couple of other pieces I just want to flag for the crew on the call today is I mentioned free and low-cost counseling. A number of you are community agencies actually funded through this stream, through the province. And it's been a significant change in making low cost or free counseling available. It might be tricky given the size of your communities or the size of the field you're in to contemplate accessing another community service agency offering these services, but really just did want to bring awareness to you of the free low-cost counseling. It's available through that website, through the link that Erin's popped into the chat. And we'll send this entire slide deck out with the all of the artifacts from our digital conversation today and the videos once we've consolidated that, likely next week. So do check out the free all low-cost counseling. And you'll see many other services in there, including Foundry Virtual, services specifically to folks wanting to check things out. And there may be a correction on the link. Erin, maybe you could verify the link and let us know if it works, and we can pop the corrected one. And thanks for that prompt. And on the right-hand side is our attempt at CMHA of creating a bit of a check-in tool. So you answer some anonymous questions, and it curates resources for you at the other end. And so it gives you a sense of where you might go depending on the answers you've created. We stood this up early in the pandemic, and it's still going live. I'm still live and still out there, so it might also be a helpful resource that you can check out too. And all of that's linked to from our website or through the government website too. And just a couple more resources to share for you. I would have used this if I did have an anxious child. Confident Parents Timing Kids is another program that's available free, funded by MCFD, and is out there for parents who are concerned about their little ones aged 3 to 12 living with behavioral challenges or anxiety. So we've got 2 streams for this program. Again, for you as community social service professionals, this might be something that you could benefit from if you wanted to. Or it might be another tool in your toolbox to refer to for your clients. So just a couple of examples here with regard to free services that are available. Specific to the community social services sector, and you also saw this in the blurb, Care for Caregivers is a resource that we stood up with support from the Ministry of Mental Health and Addictions 2 weeks into the pandemic last year. And we've been retooling this service so that it's responsive to community social service workers. And many of you gave feedback on the value of peer support for the sector. So we've made some of that service available. If you go to this website and click Care to Speak, my dear colleague Ashley Renas at BC Division works with one of our branches, CMHA Vernon, to offer this service. We're going to be doing some branding work and some other bits and pieces to make it more responsive to the community social services sector in the coming time. And we'll be doing that in partnership, but there's some service provisioning there, again, peer support. So these are folks with direct experience of the sector and a good resource to check out. So stay tuned, more to follow there on Care for Caregivers going forward. And then with, I'm sure Heather, if Heather was doing a drum roll here, we launched with the support of the province some time ago a workplace mental health hub. So the province has invested money into a few sectors, including the community social services sector, to build out workplace mental health training and supports. And the whole metaphor of the hub, and thanks, Erin, for popping the link in, is to build a bit of a house with rooms in the house for sectors. So we were asked to focus on tourism and hospitality first, and we've got some things underway there. We're pivoting to double down our focus on community social services right now. So there's a hub, and when you meander around the hub, you'll see a room there called Community Social Services. We've already had some feedback that we should probably change the picture and create a bit of a refuge for folks. I would encourage you to view it as a sparsely furnished room right now, but it's your home there as we start to build out content, training, resources for your sector in partnership with the Health and Safety Council and the Fed. So today is the starting point, the launching point of doing that work in close partnership with the diversity of your sector, our sectors, your sectors, over the coming months. So when you're in the hub, you'll be able to, so currently we've got it populated with some resources right now. You'll be able to poke around and find things to read, videos to watch, et cetera, et cetera. We're starting to turn on the engine in this hub to really build a learning and training space for community social services, again, with our partners, that's completely free, at this time anyways, completely free for people to use. We received an investment from the Ministry of Social Development, which came from the feds through MMHA to support this work with our partners. And so over the coming weeks, we're going to do much more deeper co-design work with the community social services sector to populate more of these resources and build out a training program. And you can see this is your room in that space. And we're going to need to start populating that over the coming weeks. The prize alert that I mentioned at the beginning relates to this page, and you'll see, just as a little hint, there's a little sign up button at the top there. And if you are interested and consent to being an early adopter, someone who's interested in staying in touch and potentially taking part in the training that Ashley and Erin and other folks on the team, Pamela, and our partners are creating, sign up, and I'll explain a little bit more about that prize later on in the presentation. So just to give you a sense, what you're looking at here, and you'll see this in more detail when you get the slide deck. This is not tailored for your sector yet, but just to give you a concrete sense of what we've been building for tourism and hospitality, Erin and Ashley and the team, Pamela, and our partners at Go2HR have pulled together a multi-level training program. So we've given you a taste of that, and it's hard to do in depth safely with 500 people virtually. So what we're going to do as restrictions ease, and lots of this we can do virtually, is build out a 3-level training program for community social services. And so it's going to look and be tailored for our sector. And some of that design is well underway. And we're going to have 3 levels: foundational skills, so much of what you've caught a bit of a glimpse of today, but kind of self-paced courses and learning for community social service folks of all levels to learn about mental health and substance use. An opportunity for folks to take an enhanced skills training. More of that is what you saw from Erin today: how to have conversations, how to support your supervisees, how to start changing the culture in workplaces. And then the third is advanced skills to really support employees to embrace the national standard on psychological health and safety in the workplace, and the 13 components. And the beauty of this is we're going to make that bite-sized for you. So rather than throw 13 standards at you, we're going to walk alongside you as best we can to implement it. It's a daunting task because there's a lot of community social service employers, which is why we're so grateful for the Council and the Federation in being our strategic partners alongside the Ministry in walking this work forward. So the dates here you see are specific to tourism and hospitality. Stay tuned for more information for your sector. And we want to build this within and with the sector. So that's the work underway. We are anticipating that, and we'll be very transparent about this, employers who sign up for each of these levels will start to move towards, it's not accreditation like CARF or Imagine Canada, but a certification where you as an employer could say you've achieved enough critical learning, both at the employee level and the organizational level, to achieve a CARE certification, a compassionate and respectful employer certification in workplace mental health for community social services. So, and Sherry's just written in, I know you can't see Sherry's comment, but Sherry's just written in to say how excited she is about kind of bringing about a certification program. It's not baked, it needs to be baked with you. And so that's why today is such an important day, and just so deeply appreciative to Sat and the team there for allowing us to come share some of this information with you. So before we wrap up with some questions, this is the second prize alert. So if you register an account at Work Mental Health BC, and we take your privacy seriously, so there's a piece around consenting. we will hold on to your personal information to stay in touch with you to let you know about the development of this program that we're building with partners. And if you register by July 15th, you get entered into another draw to win a mysterious $50 gift card that will be sent to you. You'll be randomly picked using our little Tumblr thing, digital. Oh, and one of you's already registered. They don't know who you are because no one can see who it is, but one of you's just told us that you've registered. So do go register. Oh, there's two of you. So all of you are registering already. We will do a random draw, and then you'll be part of our community as we move into the development of this. And the beauty of this project, and we're so grateful to the Ministry of Mental Health and Addictions and Social Development and Poverty Reduction and the federal government, is we have a few years to do this. We don't have to finish this by the end of March with the Fed and the Council. We actually have a 2-year runway to work through this and hopefully make the case for this to be in place for time beyond the 2 years going forward. So prize alert. That was my little prize alert noise. Please do go and register, and we'll be in touch with the winner shortly. So just before we wrap up here with some Q&A, I want to play one more video from Camila Sanchez, who I know is on the line today listening. Just to add to Shirose and Sherry around validating the importance of this work, and then we'll move to the other prize alert first. So give me 1 second here. I'm just going to pull up Camila. It's just a short video of some comments from Camila. 1 second here. Let's share. And I know the video quality is a bit laggy, but the audio should come through, and we're going to share these videos with the permission of our videoers after today. Erin, could you maybe pop in the chat if you can hear this when I start playing?
Hi, my name is Camila Sanchez, and I'm the Director of Sources North. I live in Prince George, BC, on the traditional unceded territory of the Lheidli First Nation. I've been asked today to share my perspective and vision for workplace mental health for our sector. I believe that it truly starts at the core of an organization. So I'd like you to take a moment to think about the values of your company or your agency, not just on paper, but how those values play out in day-to-day practice. We need to be creating an emphasis from the very core of an organization on creating an environment of support and psychological safety. So when I think of where we all want to be in terms of workplace mental health, I picture an environment where staff feel safe and bringing up when they feel stressed, when they feel burned out, or when they're experiencing mental health challenges. I also imagine a culture where open conversations are being had. So that's between peers, between management and frontline staff, and also conversations that are being led by those in senior leadership. For those of us in those positions, it also means showing vulnerability and sharing when we ourselves are feeling stressed, burned out, when we're feeling anxious, or perhaps experiencing a disruption in mood. So not only does that open the door to having those conversations, but it also gives us the opportunity to share what resources have worked for us. No matter where you are in your journey to establish workplace mental health, you are in the right place, and it's the right time to join the conversation.
So Camila, I know you're listening in. Thanks so much for that lovely pre-recorded video, and a huge thanks to Shirose and Sherry for situating their vision alongside us too. We have 15 minutes left with you, and for these last 15 minutes, what we're going to do is, and I'm wondering, Erin, I'm putting you on the spot a little here. You didn't know I was going to do this. Is maybe just from your vantage point, if you could share a few takeaways from the ground we've covered today with the audience, kind of 3 take-home messages. I'll pull up the question and answer page, and then we'll wrap things up. Erin, would you be comfy doing that for a moment?
Well, as far as putting them as three concrete things, I might have to give that some thought, but I'll try to definitely summarize. I think there's a few things. One is that this is clearly a very welcoming and compassionate and empathic group of folks with a lot of skills and a lot of strengths. So we really do appreciate you taking this time to be with us all morning. It's a huge time commitment in your busy days, so thank you. And thanks for that vulnerability as well, to share what you're going through, what some of the struggles have been, but then also about those things that you bring to the table. So thank you for that. For some takeaways, as we've said a few different ways and a few different times, we're going through a lot of change right now as a society and as a sector, but we can really work to build this foundational, psychologically healthy and safe culture. So there's lots of great work that's already underway, and hopefully we all leave this feeling very optimistic and confident that we're continuing to make really great strides in our areas of workplace culture. And then as far as those one-on-one conversations, I hope we feel like it's doable. We can have these conversations and these check-ins with folks, whether we're a manager or a colleague. Again, as I said, we don't need to have all the answers. We really just need to start paying attention and opening the doors to those conversations. So for me, at least, those were some of the key takeaways from today. If you have other takeaways, again, feel free to put them in the chat. We'd love to see what landed with you as well.
Thanks, Erin. Before we hand things over to Satvinder, I will pop into the chat a Mentimeter link for us to gather any questions you might have. We had one question earlier from someone around how to support people who are appearing to be burnt out, particularly at this point in the pandemic. And so we will take those questions as direction for how we can focus the training and learning over the next few months. So thanks to the person who posed that question. We haven't forgotten it. And we will endeavor to find ways to shape our training and learning. Just to give everyone a fair chance, if you want to use the chat in WebEx to share what you think has changed about me from the beginning to the end, we'll just allow you to do that. And I'll tell you what it is after Sat's spoken. And we will, to make things fair, we'll do a random draw of the folks from the chat here. And when the materials go out, you'll learn who the winner was. We'll make that fair as possible. All of you are clearly, we'll just give you 30 more seconds here. Oh, some of you think I seem more relaxed. That's true. I do seem more relaxed. Maybe I seem very stressed at the beginning. But I do feel a bit more relaxed now. I do have a lot. Yeah. So thank you for that. So 3, 2, 1, we will close off the prize alert. So any answers received after now won't count. But the spot the difference was I changed my shirt 3 times. I had 3 costume changes there. So all of you were very keen-eyed, eagle-eyed. Thanks so much for weighing in the competition. We'll pick the winner randomly. And in riffing on Erin's comments, it's deeply honoring to be here with such a group of caring people, such an invitation. Thank you, Sat, and the council for having us here. I know there's a number of key players listening in from CSIR and the Federation and other partners. And we really look forward on behalf of CMHA, my team, Ashley, Erin, Pamela, our colleagues at the Federation and at the Council to be building things in partnership as we go forward, and a big thanks to the province. Over to you, Sat.
Wow, that was a fantastic presentation. Thank you both, Johnny, Erin. So interactive, I wish I knew a little bit earlier. I would have actually started to change a shirt, be a part of the contest or whatnot. But I think the presentation was excellent. I love the interaction and just sharing some really critical tools and pieces to us. I particularly really loved what Erin had said, and I think we need to take a moment to breathe, to check in with ourselves, to take that moment to really understand what's happening around us, and as service providers across British Columbia, it is providing those supports for those folks out there in industry and really being there. And we forget to take that moment to take a breath. And I think with the impact of the pandemic, it is only quadruple folded the need and the attention that we pay attention to address this outstanding issue that has been there for a very long, long time. And so, we are very excited about the work that is being done, and we thank the ministry for supporting this as well, and the Canadian Mental Health Association for taking lead and partnering with other organizations that are doing similar works to support mental health. I do want folks to know that discussions are taking place with sister health and safety associations across British Columbia and different industries to how we can learn and support one another as well. So it's not just limited to our industry, but understanding best practices across the province as we're moving forward. I am really excited also to share with you that the council will be releasing or launching their website very soon as well. And so we'll be able to provide very important content, such as the ones that I presented to you today, where folks can log in and access and basically utilize that information. And as we launch that, we are obviously developing it. So we welcome your feedback in this process as well. I believe that we will be having another session in September, the violence prevention training, which is scheduled for September the 25th. We will be sending out that link, the registration link, that as we get closer to that time and that date. And our keynote speaker is Phil Eastman. Eastwood. I'm going to actually have to ask him if he's related to Clint Eastwood. Probably not, but just recognize that. I think that's kind of very interesting. So I'll make sure that I clarify that with everybody. To wrap things up, basically, I encourage everyone to respond to the e-survey that's going to be sent out, because as I mentioned earlier at the beginning of the session, it really starts with you and engaging with you and listening and learning and seeking your guidance as we're navigating through this process. Just the vast diversity and the complexities of our sector is so great and reaches so far. It's so critical that we hear from you and we integrate and listen to your voice. While I'm speaking to you, I would like to pass on that the council would like to take the opportunity to acknowledge and express their gratitude for all the hard work organizations are doing. Executive directors, support staff, supervisors, those frontline workers that work each and every day to provide support for the most vulnerable people in our communities throughout British Columbia. And so I thank you very much for participating today, taking time out on a Friday, a very sunny Friday. Special thanks to Eric, Sherry, Matt, Robert, Doris, David, and Fiona for all the hard work that's being done in the background that folks are not aware of. And again, we would like to thank you very much for your hard work, and we encourage you to continue to move forward. And again, thank you again so much for your time, and have a wonderful weekend. Thank you. We'll just wait until folks log off and we'll connect.
As everyone leaves, I'll just give an extra shout out to Matthew for our tech support. Thank you. It's always a big sigh of relief when we know things will go nice and smoothly. So thank you, Matthew.
Well, my pleasure. It's great to watch you guys do this. They're amazing presentations.
Thank you so much, Matthew.
So,
are we in our special space?
no, not yet. I don't know if Matt, you could do that. We're just going to have a quick overview.